My name is Don Gips. I'm the CEO of the Skoll Foundation. Skoll is a platform built by Jeff Skoll, who is one of the founders of eBay, to support social innovators working around the world to solve the world's biggest problems. We do that by investing, connecting, and championing these social innovators. We worked in pandemics and health system strengthening, climate, economic opportunity broadly, to really drive social change at scale by finding the best social innovators out there, helping them grow, helping them connect to government, to other funders, etc., and scale to change the world. Social innovators do use tech, are also tech innovators quite often. They'll find new ways to adopt technology to solve a social problem, so I wouldn't make that separation. And even some of them are for-profit social innovators. So I'll give you an example, an organization called M-Pharma in Ghana that's using technology and the fact that pharmacies are all over Africa to reinvent both the supply chain for pharmacies and to make pharmacies a primary healthcare center. So training the doctors better, bringing in, using technology such as AI to help make sure that the pharmacists can deliver more services than they used to, adding more benefit to the community, more benefit to that pharmacy, and technology enables all of that. So I think any social innovator who's not figuring out how to use technology is missing one of the great opportunities that exists for them, but you have to figure out what technology works in the context you're operating in. I think pure technology innovators, they're quite often just focused on the bottom line. We are focused on both the bottom line, making sure that these organizations can grow, but also the impact on society. We work in a number of different areas. So there are social innovators who really have figured out how do you take community health workers in Africa, where they're the frontline workers, but they've largely been unpaid, not trained, not supplied with proper equipment, and not integrated into the health system. So we help innovators who are we support innovators who are helping to help get them trained, paid, and integrated into the healthcare system. Scaling across Africa, they're the frontline healthcare workers, and they can do a lot of the work that doctors or nurses would do with new technology, enabling them to offer care right where it's most needed, and also identify things like the next pandemic. They're critical frontline workers, and we've helped make them, or the organizations we support have helped make them a critical part of delivering global health care in Africa. The geopolitical environment is shifting around us. Social innovators are needed and entrepreneurs are needed more than ever. I think we're at a moment where we're going to need to reimagine how a number of systems work. So thinking long-term, trying to say, in a world of less public resources, how do I grow? How do I scale? What is my thinking? Can I make myself more efficient? Can I join with other organizations? I think this is going to be critical at this period where the environment is shifting, but that's where entrepreneurs are their best, is rising to an occasion when they're shifting. Working, I think the other thing I would say, particularly for social innovators, is you need to think about where government comes in, where the private sector comes in, and where civil society comes in, and integrate across all of these.